Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everybody, welcome back to Friends with Fertility. Today we welcome Dr. Sarah Oreck. Welcome, Dr. Sarah.
Thank you so much for having me.
I'm going to share your bio with our audience, and just to give you a little background about Dr. Sarah Oreck, she is a Columbia University trained psychiatrist with a fellowship in reproductive psychiatry and the co-founder and CEO of Mavida Health. Driven by a deep frustration with the shortcomings in maternal mental health care, Dr. Oreck envisioned Mavida Health as a platform to revolutionize access to high-quality mental health services throughout the path to parenthood. As a practicing therapist and prescriber, she continues to combine cutting-edge medical treatments with holistic whole-body approach to mental health. She is the daughter of South American immigrants and grew up between Los Angeles and Colombia, and she currently lives in LA with her husband and three children. I feel like I'm having a little bit of a hard time getting my words out this morning. So you're one of the few psychiatrists that focuses on reproductive health and mental health, I should say. How did you get into that? And can you tell us about that for people who aren't familiar with what that even means?
Absolutely. So it's a pretty young discipline within psychiatry. It's probably like 30 to 40 years old. There's only 15 programs in the country that graduate mostly medical doctors in this type of fellowship. So it's really, really limited. There's some psychologists that also do it through their PhD programs. But again, it is where female reproductive hormones, we know, have a distinctive impact on mental health care from your first period to your last. For example, women have 2 times the rate of depression and anxiety within their reproductive lives. We know that the transformation to motherhood is one of those really crucial times. And this starts all the way from trying to conceive to conception. So it's this really distinctive time in people's lives, especially with this transformation to motherhood, where I think it's really important to have its own discipline. Instead of what we have now is we really base everything on studies done on men. And we know that there's not a one size fits all. And so what I saw kind of in medical school was a lot of women feeling disenfranchised, not heard, gaslit by the medical system, frankly, because basically the studies didn't apply to them. And so they were told, this is in your head, this doesn't exist, this isn't really a side effect, this isn't really a symptom. And so what's really exciting is that the whole field really targets that. And it's growing. We have a lot of therapists that are becoming specialized in this area. So it's a really exciting and cutting edge part of behavioral health that we really think is kind of like how substance use became its own kind of carve out of behavioral health, how eating disorders is this very specific specialty within behavioral health. I really do think reproductive psychiatry and psychology will become that.
Amen. It's about time. I feel like there's this, I guess the idea of in the 60s where the women were given their Valium for the stay-at-home moms and how that came about, and people not really believing that there was really a thing, that these stay-at-home moms were struggling with the kids and everything.
That's right.
I kind of feel like it's this same type of idea, although hopefully more legit and more studied, because I think more patients are becoming more educated about the general idea of medications and what this means and why it means, and recognizing that, okay, that's great that it's there, but tell us more about that, because they are so hesitant now to believe, well, does this really not going to hurt my baby? Is this really not going to hurt me long term? And how does that come to play? So how do you approach those, I guess, well-educated patients now that are questioning these things? My opinion is, if it's making you feel better and it's putting a Band-Aid on it right now and stop the bleeding, if you're at a point of a critical situation, let's do that first and then kind of reevaluate, because I've seen some people who have struggled so long, and I come from a family of mental health disorders, so I'm well versed in it, unfortunately. But what are you seeing in your side of the practice now with patients?
Yeah, of course. I mean, I think a couple things to address. So, obviously, in the 50s, a lot of benzodiazepines and sedatives were dispensed to mothers who were really struggling at home. And I think that this wasn't evidence based at all. This is
No,
really focused on, I don't want these women complaining, and here's something that can stop them from doing that.
right.
So, that is really, that phenomenon. I think the extension of that and the modern day equivalent of it is really the mommy time, the wine time, the happy hour. It's take this alcohol and kind of sedate yourself, basically. So I see that as more problematic. But of course, psychiatric medications, evidence, scientific progress is something that's in question right now, which is really unfortunate. But what we do know is that untreated mental health issues during trying to conceive pregnancy and the postpartum can lead to a lot of complications. Firstly, in pregnancy, we see early term birth, we see small for gestational size, we see increased risk of C sections, NICU stays. And so it's really important to use all the tools at your disposal to feel good during the pregnancy. Your health is going to be the most important, your mental health, especially, is going to trickle down to your baby. The number one complication of childbirth are mental health issues. And I think people don't think about this enough. We get that gross diabetes test. We get our blood pressure taken at every single appointment, but we're not asked, how are you doing? And these have very serious implications to the point where we know, for example, if you are an SSRI, that's a selective serotonin reuptake inhibitor, which is an evidence based treatment for anxiety and depression, one that has been studied more than any other drugs in pregnancy, for example, and deemed to be safe. There's obviously risk with everything that you take, but we think overall the risk is less than your untreated depression or anxiety during the pregnancy. If you stop that right before your first trimester, for example, you have a 70% risk of relapsing into depression during that pregnancy, which is really kind of unbelievably high. And so I think what is really important is to think about nuance, which I know is hard in today's age, but that it's not right for everyone, for example, to stay on medication, but it might be right for you. And being able to find a practitioner that sees all of those risks and weighs the risks of not taking medications versus the risks of taking medications is really what's important. This is not everyone needs an SSRI. That's certainly not the case. We actually know that for mild to moderate depression or anxiety, people would be better suited with therapy and with support. And so that's what we do at Mavida Health, which is really exciting. We do it all. We have the medications, but we also have the individual group therapy and couples therapy, which is something people don't talk enough about because a lot of the issues stem from that relationship and how much it's changing.
Absolutely. I mean, I feel like all of those areas that you just touched on, we could take avenues
I
into
know.
all of them. But I just want to start by what you first said was, you know, early term, NICU stays, et cetera, all of those things in conjunction with fertility issues going into it, just being aware that those are big things to go through. You might need something to bridge your mental health to the other side. Most of these things are just situational. It's not like you're going to be on it forever, but it is something that can help you get to the other side in a healthy state. And don't underestimate that healthy state, because it really does affect our physiology and our whole body. And especially if you are the mom and you're the one that's supposed to be taking care of this human being, whether it's inside of you still or on the outside, it is really critical that you take care of yourself first and make sure that you are addressing that, because again, it will just lead to other issues.
That's 100% right. And for those that have struggled to become pregnant who have used assisted reproductive technologies, I always like to tell people your pregnancy started when that journey started. So you may have been pregnant for 4 years. Like this has been such a huge and long, torturous journey that for those people, especially, you're at a higher risk for having pregnancy related mood issues as well as postpartum issues. So please use all of the resources that you have, and it's not your fault. But those that have gone through fertility struggles, there can be a lot sort of going into the pregnancy and postpartum.
100%. And not to put that on
No,
someone before
not
they're
for
going
everyone.
into
Right,
it, but
right.
I want people to be aware of like, oh, okay, I know postpartum's a thing, but it could be even more of a thing if you've struggled with fertility issues or miscarriage loss or any of
Yep,
those things
yep, that's
prior
right.
to. And I think the big thing when people finally do get pregnant are, God forbid, I don't want to take anything, right? Like I don't even want to take a Tylenol, let
Yeah,
alone a psychiatric drug.
I know.
So I think really stripping down the notion that yes, our baby is taking those things on, but again, really focusing on the mother and the mother's health, mental health, and how that trickles into the future, right? What
Yes.
happens and the trauma that we might have from fertility or loss and then into pregnancy and maybe traumatic pregnancy and NICU, that carries with you, whether you're in a strong mental state or not. And how do you address that with somebody to let them know that it's okay and it's not their fault? Because when you're in it, you feel, of course,
I
it's my
know.
fault. How can it not
Well,
be my
I
fault?
know, and in some ways, our culture sort of tells us that it's, a mother's failing, right, is the reason my daughter has this or my son has that. But I think it's really about shifting that script a little bit with SSRIs in particular. So that selective serotonin reuptake inhibitors, those are the most commonly used medications for depression and anxiety in pregnancy. What's really exciting is that we know that there's no congenital abnormalities associated with it. We know that kids have been followed actually until they're 18 years old who had been exposed to these medications in utero, and they have not been found to have issues with their IQs or their motor skills. So, really consistent sort of growth that doesn't differ from kids that were not exposed. And the one thing that does happen in about 10 to 30% of pregnancies is that there's something called neonatal adaptation syndrome, which is when babies may have a little bit of a withdrawal effect from the medication. They may be a little bit fussier, harder to feed, cry more. But it's like, show me a baby that isn't like that when they're first born. Like most babies are a little bit fussy because that's probably the most traumatic thing that's ever happened to them. They go from your warm, dark womb to this bright, cold world. And so what we find is that that goes away within 2 weeks. It does not require a NICU stay. Moms can breastfeed on
And
it.
how do they know the difference between that's a withdrawal versus it's just a baby
They frankly
that's
they don't. So some of that had been studied sort of in these
okay?
closed settings, but it's really hard to tell, frankly. And most of my patients have not complained about having that issue. And so we're really armed with great supporting data. I mean, in the millions. So that's really exciting. But I think it's also really important to kind of think about, these issues aren't our fault. There's a lot of systemic issues that make becoming a parent really hard in this country. From the lack of support, from living far away from your support systems or your extended family. We weren't meant to parent this way, sort of in a nuclear family in a big city all alone. We were really meant to have more support. And so that's a little bit about what's happening as well. So, in this more systemic way, we need paid federal leave. We need these, affordable childcare. So you don't feel so overwhelmed if you have a child already and you're pregnant and struggling, or you're trying to conceive and going to your assisted reproductive technology, sort of IVF, meet
Yeah, it's a
appointments.
lot.
I
Just
mean,
hearing all of these things again just kind of brings me back to my own situation of, yes, having 3 kids in 3 years and not being on any of the medications and having 3 fussy babies, and I
I
see
know.
my patients now that have beautiful, chill babies. I'm like, that was not my
I
situation.
know. Me
But
neither.
you never
I had
know,
three as
right?
well in 4 years, and it was
Okay.
not my situation either. My first two
No.
were so fussy.
Yeah, exactly. So I think it just goes to show that having a step back and a broader picture to say, okay, just like I tell with people with losses, I know lots of people in their 20s that have miscarriage losses and in their 30s and 40s. So it's not just because of your age. It's not just because of this. It's across the board. So always remember to take a step back and look at that 30,000-foot view and see what is good for me and what is going to help me and my family right now, because getting through this period of time is really what's critical.
Yeah, there are 2 points on that. So my first baby was during the pandemic. I was pregnant and it was like March. I was 3 months pregnant when it was March 2020.
Mm,
And it was just a really frightening time. And sometimes I'm like, was I too anxious during that pregnancy? Is that why my son is doing X, Y, and Z? So all of our brains are wired like that. I mean, I have all of the education and I know that's not the case, and my brain still goes there. But what's really important to remember in those cases is that I think we think we can control more than we can. Certainly, there's a genetic factor. If I have baseline anxiety, it's likely that my son probably will too. But certainly, there are things that I can do to support him, to support myself, that can be helpful. But a lot of things we can't control as much. So I always get the thing of like, well, I had a couple margaritas, and then I had, before I knew I was pregnant, and then I had a miscarriage. It was totally my fault. Not the case.
right,
Most early losses are because of genetic abnormalities where the baby simply wouldn't survive. So it's really hard. I think this happens in a lot of parts of our life where we wish and that we had all of this control, but we actually don't. And so it's a
right.
little bit of surrendering to that, which I know is really, really hard.
100%. And to your point on the studies and all the things now, if you are questioning it, look up the studies. We have
Yeah.
an amazing ability now to actually
Yes.
look up the scientific studies that are done. And if it doesn't feel good to you, if it wasn't long enough, if the whatever about the study doesn't feel right to you, then go on to the next so that you
Yeah.
can make your own decision. But I think the
But
practitioner,
bring that to your practitioner, because most people aren't well versed in reading scientific studies. That doesn't mean you can't, but I
right,
just want to be kind of careful that you do and you are interpreting the results correctly. A lot of newspapers and sort of media sometimes grab the headline without
right.
actually looking at the context. So I think that's
Mhm.
also incredibly important. Like there's been a lot of headline grabbers about autism and its relationship to taking an SSRI during pregnancy. All of those studies have subsequently been debunked. And what we saw is that they weren't accounting for age of parents. Age is one of the closest associations that you're going to have with the diagnosis of autism. And so this was predominantly older mothers over 40. Not that that's always the case, but that is going to be a higher risk, as well as older paternal age, I think above 60. And so, really important also to kind of make sure that you are kind of getting everything as it should be. Like, for example, people still cite that Lancet study on the vaccine connection with autism, but that has been debunked and retracted. And that physician who did the studies, his license has been taken away.
Yeah, bottom line is do your own digging and find a practitioner that can help
Yeah,
you and partner with you to feel what's good for you,
that's right.
because you don't want being on medication to cause you more anxiety
No.
because you're so worried about what am I doing and what am I taking, but at the
Yeah,
same time educate yourself as much as you feel comfortable to.
and what's really important about that, and I think the huge distinction is that most OBs, they can offer you medication, they don't offer you therapy because they can't do it. And
Hmm.
getting into a therapist is so hard these days. There's wait lists, there's out of network costs. And so really trying to find a reputable place that can get you in network care is what I decided to build with Mavida Health, because we know that therapy is actually our first line of defense. It should come way before an SSRI. But because of our scattered kind of mental health system in this country, people are offered the medication first,
Right.
and that's problematic.
In all kinds of ways, and not only just with the SSRIs. I think
Everything.
it's everything.
Yes.
So that's a whole nother rabbit hole. But
Yeah.
I'm happy to hear the idea of going through therapy first. And again, I know a lot of people that come to me as a coach over 15, 17 years now had left therapy to come to coaching because there's more of an open dialogue. What I see now with therapists is they are more open, especially with their fertility journey. And I love that because it is such a unique experience, and where I think people find that connection, which I really
Oh,
believe is this
100%.
new currency, is where the therapists are opening up to say, I understand that, I've been through that, I have 3 kids under 4, I know what it's like to have all this situation happening on me. And so I think it's really important to talk about that a little bit more, that again, you're not broken, nothing's wrong with you and your partner. You're this is normal. It needs to be an everyday type of conversation with couples about, okay, what therapist do you guys see? What's going on with that, instead of this big kept secret. And if you don't feel aligned with them, find somebody else, because there are so many people out there that are now really helping and wanting to move this path forward, to say we're kind of getting back to that place of, you're talking about how we're meant to be in tribes, we're meant to be
Yes.
partnering and building families together, we're meant to be helping each other when we're going through hard things. And part of that is this new wave of, whether it's therapy or coaches or psychiatrists or all of the above, that are opening a dialogue to say, no, how are you really doing? Right?
And yeah, and
What's going on with you?
you can get a lot of different things from a coach versus a therapist.
Right.
At Mavida Health, we really think about therapy as it. The first kind of point of it is to really clarify for you what your values are. And values change a lot when you're thinking of starting a family or when you're pregnant and postpartum. And so that's sort of the primary. And then we give you skills to really help yourself in times where you're struggling. Many of our clinicians have lived experience. So, my co founder and I, for example, part of it was that I was a reproductive psychiatrist, but I had a second trimester loss. I went through
Sorry.
IVF, thank you. So, have this lived experience. And it was really through that second trimester loss after having my two kids that I realized, if I can't get the help that I need and the care that I need, and that's affordable, who can? And really wanting and sort of becoming passionate there. Also, a lot of the people were lucky that most caregivers, therapists, prescribers happen to be women who already have had families and really want to give back to this time, because I think we recognize this is not just about mom. This is about a whole family system. This is about her relationship with her partner. This is about the child. I mean, kids right now are just utilizing child adolescent psychiatry and therapy services for a variety of different reasons. We can talk about the social media of it all, but I do think part of it is also, can we kind of interfere with that? Can we help that by kind of getting to the root cause, to those first couple of years that are so integral to attachment? If mom and her family's in a better place, I guarantee you that those children will have better mental health outcomes.
Speaking to the choir. And I think some of that is beyond our generations, right? So sometimes that's healing that still needs to happen
Yes.
with the previous lineage, right? And
Yes.
and it doesn't even belong to you, but it's showing up for you now that you're starting your own family. And maybe you thought, like, oh, I dealt with that when I was in college or whatever it may be,
It
and now
comes
it's
right back
coming
up.
up. Yeah, so
Yes.
it's really important to really address those things so that your children don't, right? This whole thing of epigenetics, we know this is a real thing now,
Yes.
and we want to make sure that our kids are not carrying on these things that we don't necessarily want them to carry on. So, in your opinion, does the current medical system fall short in addressing the emotional and physical kind of combination of things together?
Oh yeah. I mean, that's absolutely the case. I think we're very much on kind of treating once the symptoms have really festered and things are in a really bad place, versus the preventative care, where I think that there could be a lot of benefit. I think where it's getting muddy is starting to take down institutions that do work, starting to kind of talk about vaccinations, which we know have eradicated illnesses. And that's not what I'm talking about, to be clear. If you get sick here with a rare disease, the United States used to be the best place to do that, because we have the studies for all of that. We've done all of the cancer research. We are kind of cutting edge in that way. I think we're going to fall behind, unfortunately, due to what's been going on. But I think we can do still more around preventative care. And that's where I think therapy, before you even think you need it, the coaching, the support, to really kind of help you be in a better place in terms of support, can be one of the best interventions for becoming a mother. But again, that I think it's been such a confusing dialogue with so much misinformation that it's hard for
Right.
mothers. And I think mothers are being targeted. They're being told that the red food dye is the problem. They're being told that the vaccinations are an issue, and that leads to a lot of confusion at a very vulnerable time where you're just trying to protect yourself and your baby. So I know why it
100%.
works, right? Why it works so well.
And we're
But
so
unfortunately,
used to believing the people in the white coat about,
Right.
no, you're 30 weeks pregnant, you have to take this, you have
Right.
to inject yourself with this so your baby is safe. And traditionally we just go on and trust that. And I think, not saying not to trust that, but also there's so much noise happening right now,
There's so much noise, but I think we're
So
missing kind of the missing, the trees from the forest. Like I do
100%.
think that there is and really coming from people who don't have a great evidence-based knowledge, kind of throwing out these red flags that really aren't there. A measles vaccine is not a red flag. It prevents measles, which is now spreading in our country and hadn't before.
Yeah, unfortunately, I feel like the whole COVID thing has turned everything upside down for people, and it's a shame because you didn't hear that type of thing before with, whether or not to give your kid the vaccine for measles or whatnot, And so
Yeah.
it's really sad that something so big that had to happen for now people to question even the things that are proven to
But
be good and have
I
changed literally the world with
literally
something like
changed the
measles.
world. I think what we're
So,
going to see, unfortunately, is health decline, probably our sort of life expectancy decline in the United States, including of our children, because of some of those policies, and sort of dismantling the vaccination program is going to directly impact that. So I'd love to talk about kind of how we can support our mental health, but frankly, we're sort of dismantling it as we go.
well, hopefully we won't get too far down that road,
I know.
and I think people being their own agents to say, I want to do this. I looked this up. I talked to my doctor and I think this is the right decision for me. I have a
Yes.
family history of this, or
Right.
I'm going through this. And so how do you help your patients to determine what is normal stress with
That's
ART
a great
or anything
question.
like that versus, okay, where do I need to now, like, have somebody else step
Yes.
in and help me?
I think this is a great question because it comes up so much, and I think I love social media because it universalizes this is really hard. That, like, it's hard to go through IVF, it's hard to be pregnant, it's hard to be postpartum, but I think the risk is it normalizes it. So, like,
Hmm.
you should all be struggling, and that's not the case. So what I say for my people who are going to ART or the sort of reproductive issues is, if your quality of life is changing, if you are no longer able to function at work, if your relationship is really having issues because there's so much stress between you, then it's time. So I think functioning is one of the main things that you should look at. If you're really feeling hopeless, that life isn't worth living, those are huge red flags that it's time to get support.
Right. That I would say is pretty extreme. On the other
Yes.
hand, I would say, though, I have yet to really meet, out of thousands of women that I have helped, anybody who doesn't struggle through
Yeah.
trying to get pregnant, whose life isn't changed, whose
Right.
mind isn't
I mean,
consumed with
listen,
how do I get pregnant? How do I stay pregnant? What's happening there?
the
So it's
estimates
so
are
normal.
yeah, the estimates are that people who go through IVF have about 50% risk of depression or anxiety. I think that's in the 90s. I agree, for some people though that I've seen, like, yeah, they struggle to conceive spontaneously, but then all of a sudden it works with IVF and maybe it's not as stressful. But I agree that it's in large part, most people. And where I really struggle with is that that's something that reproductive endocrinologists, those are the fertility specialists, aren't asking about. And we do know that there's a connection between your mental health and fertility status. It's not positive thinking, to be very clear.
Right.
That doesn't get you
We
pregnant.
can't positive think our
No,
way to things,
no, no.
unfortunately.
That's
An
unfortunately not what's
affirmation's
going.
not going to do it.
No, an affirmation is not going to do it, but there is
Mhm.
something about, am I feeling like I can take this on? Am I feeling stable? And I always think there's room for a coach or a therapist to help you get those tools. Like, I went through IVF, I was already in therapy. Like, there's no way I would have done that without therapy.
Mhm.
Like, there's just no way.
And for people who aren't already in therapy, just know it's temporary, right? It's like
Yes, it
having a
doesn't have to
business
be
coach when you
forever.
want to, like, go to the
Exactly.
next level in your business, or you're a
Right.
professional tennis player, you want to get a coach to get
Yes.
to the next level. It's the same thing. So I think people still have this stigma of, oh my gosh, I'm going to take this on. I'm going to have one more
I love
appointment. I don't
that.
want to have to do this. But it's just something that's not really known as something that's talked about or
I
accepted. And
know.
I think that it needs to be, just like it is in every other area of our life, you
Well,
know?
and like when you're in a relationship, the couple can suffer so much through that experience. There's resentment, if there's right male factor in for it's like it's your fault,
Mhm.
it's my fault, whatever it is.
Financial issues.
Financial issues. And so what I think is so
Hmm.
important is you do not have to go to couples therapy because you're going to get a divorce or break up. That's
Right.
not the point at all, right? You get a you like I loved your metaphor to like coaching. You get it so you can level up. So you can
Mhm.
have good communication when it's starting to break down. So you can figure out your intimacy and your sex life when it's
Yes.
kind of, at a crossroads or it has so much stress on it. And so it's really about like how do we improve ourselves, and these are some strategies. How do we get, what we need during these really hard times? But I think it's hard because there's so much stigma around mental health issues. It's not that something's wrong with you, is why you're getting this care. It's because you want to prevent, right? And you want to do better and have higher quality of life. So I think we have to definitely talk about that more.
And again, coming from somebody who has a family of mental health history, I think knowing the differences of, we are in a situation that is stressful that
Yes,
causes, whether it's depression or anxiety or whatever, versus somebody
it's
who
not you. Yeah.
has a chronic issue with
Mental health
depression,
issue.
or yeah,
Yeah,
or a
exactly.
mental health issue. And I think people kind of lump it all in one bucket, and so they're like, I don't want to go over to that bucket. That's not
You're
me. I don't want
not.
to be associated with that. And
Right.
I want people to hear you say, no, you're
Yeah.
not. It's very different. It's very different than somebody who has long-term, maybe
Yeah.
they have
Listen.
bipolar, or they have,
Right.
I don't know. There's a lot of different, like,
And
heavy duty psychiatric
for
things, but
people that have those issues, of course, when there's something like this, they're going to be at higher risk for
right.
relapse and for mood issues. But I think that the most resilient person that has never experienced mental health issues, guess when it starts knocking? It's during these times. And we also think there may be a hormonal impact and sort of attribution to it. But for my co founder, for example, the first time she ever had a mental health issue was after her loss, and she also had a second trimester loss and into her subsequent pregnancy. And so it was this transition that was really hard, and the first time many people in my practice ever experience any mental health issue, and it might just be the only time in their lives when they have it,
Hmm.
because all
Right.
of the stressors kind of come together for the perfect storm.
Right. And I want people to know that it's okay. It's okay to feel sad, and it's okay to feel depressed and defeated and whatever during this time. It's normal. Of course you would. And that's why getting the help during that time can help you through that.
That's right.
So I cannot push this enough without feeling like I'm pushing it. But at the same time, if there's anything that I would want to say, is get help sooner, talk to somebody sooner.
Yes.
And when I say get help, that can mean lots of different things. It's just like telling somebody, go get checked out by an RE, like the fertility doctor. That
Yeah.
doesn't mean you're going to do IVF. It just means let's get the lay of the land. Let's see with what we're dealing with. And it's the same with talking to a therapist or a psychiatrist, to just say, let's get a baseline. Where are you at right now? Where are you thinking? What's happening?
I know.
And
I love the people that are like, I'm okay right now, but I want to get in touch just in case something happens, just so I
right.
have my foot in the door, so I know who to call. And I think that's such a great
That's
place to
amazing.
come to from. Yes, exactly.
Yes.
That's
Unfortunately,
preventative care.
right. And unfortunately, I don't think many people think that way, right? Most people come to me when they're very broken, and it's been a long haul of lots
We're
of
used to
losses
going to
and
the
things.
ER, right? And going to
Hmm.
like that level of care instead of going to your doctor consistently and making
Right.
sure everything is going well. And I think that's kind of the revolution that mental health needs.
Well, almost to the point of we have a primary care physician, right? You're supposed to know all the things about you and whatnot. But even that, I think people are getting psychiatric care from their primary
Oh my
care
God.
physician.
Well,
And
it's
I'm
not
like,
how
you
like how
guys,
many women have primary care doctors? They use their OB, and their OB is like, I can't help you. Like I don't treat flus, right? Like
right.
that's
So if we could get a psychiatrist on board at the same level of checking in as
that's right.
a regular primary. And so I would argue that that's actually more important than a primary care at this point in our lives. Most of us are pretty healthy. We know what to do, and
But
whatever.
mental
But
health issues abound. And we are talking about the transition to motherhood, but then the next kind of place where things really rear their ugly head is during perimenopause, which, as many
mhm,
of us delay childbirth, is starting to happen in your 40s. Perimenopause takes about 10 years. That's the period before you hit menopause, which is 12 months of not having your period. And the average age is 51. So people experience that in their 40s. And that's the other upheaval, body changes, hormonal changes, psychological
right.
changes.
And then back to the OB, she doesn't know
Right.
necessarily how to affect the mental health
Yes.
with what's happening with the hormone health.
I
It's kind
know.
of it's kind of a crazy thing. But I think being your own advocate and digging in and making sure that you have your team together of all these people that get you and
Yes.
understand and align with your beliefs is really important because it is quite a small window of from having your babies and trying to get pregnant to that perimenopause and what's happening next to but all of that is so critical because hopefully in that
That's right.
time you're then caring for little ones, right? So you want to be the
Yes.
best version of yourself that you can be for them. And I know for myself it's a lot, having two businesses and three kids and all the
So
things.
much.
Like it's a lot to not feel like you're navigating it alone all the time and the only adult in the room when you're trying to deal with all these things. So someone to be on your side, I think is really important. And to have that instead of triaging the situation, to have that preventative care, I think is a great motto to have in your life just for
Or
everybody.
yeah, or even to help you kind of with the noise. So I see a lot of people getting all of their advice for parenting and actually mental health on social media, frankly. But there is so much noise that it's really hard, especially when someone is in this vulnerable place. How wonderful to have an outlet like a therapist where you can kind of say, I've been hearing this thing and figure out whether it aligns with your values or not. I see so many
Right.
people wishing that they could be these gentle parents that don't ever raise their voice. But when you are kind of going from an empty cup, when you're not getting the care that you need, it's really hard to be that way. And then what you're doing is sort of this false, inauthentic version of it,
Mhm.
because you're not actually feeling that calmness inside.
Right. And I think no matter who you are, no matter how educated you are, no matter
Yeah.
how well versed you are in reading your parenting books, you're still going to get to those points. And having somebody to talk through that with you is
Oh,
really, really helpful.
and know that parenting is always kind of a rupture and repair, that there is always room for repair, no matter how much you scream or what happens.
Right. So, what advice would you give somebody who's listening that's both trying to conceive and maybe just having had their first child and kind of starting? So, in those two separate areas, what advice would you give those two women?
Give yourself grace through all of this. It's really difficult, and both of these times are ones of like having to really get into the I don't control everything and having to release some of that kind of wish that we have to kind of control more or to be bigger agents in our sort of change and of our lives. But I think some of this means letting go, but also get your village, whether that's through friends, whether that's through family, whether that's a coach, whether that's a therapist. Start to sort of collect and arm yourself with all of the people who could be really helpful, because we know that that's more important than a fancy crib or a fancy stroller. But people spend so much time thinking about those things
Mhm.
versus like the care that they need. And that truly during this time, you need care. And so, what does that look like? How do you get that support, whether it's from your partner? For people doing IVF, it's like, especially the ones that are like, they're doing their own shots, like, get your partner involved. Can they have the timers on their phone? Can they have the schedule? Can you make this sort of a group effort? Because it can be so isolating when
Right.
it's not.
That's great advice. And I think to that point with the partners, they want to be involved and they're looking for ways of how they can help and they don't know how to help. And so the more that we can say, hey, can you please do this? Can you please do
I
that?
know. I wish they
Rather
could
than
just read
having
your
them guess.
mind, but
Yeah, but they can't. And so the
no,
more that we can be specific of what it is that we need, I think is helpful for everybody involved. So
that's right.
how can people find you and work with Mavida and all the
Yeah,
good things.
absolutely. So I'm on Instagram at Sarah Oreck MD, and we also have at Mavida Health. And you can go to our website, mavidahealth.com, where you can access all of our app's content and community actually for free right now, which is really exciting.
Amazing.
And then we have clinical care in California, New York, and New Jersey, and it's in network with most insurers. So it's a real game changer. You can get in within a week. So we are really hoping to change this sort of I think the narrative of your OB or your PCP just putting you on medications, and for you to have a more holistic approach that includes individual, group, couples therapy, as well as that prescribing if and when you need it.
What a beautiful experience for people. And thank you for putting that together and putting it in the world for such a needed community is awesome. So thank you
Thank you
for
so
being
much,
here and thank you
Elizabeth.
for your time. And hopefully our paths will cross soon.
Yes, yes. Thank you so much.
Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.